Hello, my name is Crystal Kroll, and this is my assignment for case management at Kennebec Valley Community College. This is oral communication article presentation. My article that I'm doing this on is called Mental Health in Law Enforcement Professionals, Trauma History, Psychological Symptoms, and Impact of Providing Services to Sexual Abuse Survivors. And this is written by Kathleen Milbeck and Melissa Polosny and Victoria Follett. I chose to focus on mental health in the professional environment to include law enforcement and mental health workers. This dawned on me because I've been a mental health worker for nearly 4 years now, and I'm a military police officer for the United States Army. I think there is a certain stigma involved with people who work in mental health and in law enforcement on seeking assistance from PTSD and all the mental health problems that they may have occurred in their lives, and I think this article helps define and explain how self-care for those individuals is crucial to being successful in their work environment. This article correlates best with Lesson 19, which is all about self-care and the ethical practice, which starts off by saying that over 29% of therapists and 19% of officers are condoned to having childhood trauma. According to the article, this is for female law enforcement officers, 40% had childhood trauma, 20% child sexual trauma, 20% child physical abuse, 60% emotional psychological abuse, 20% adult sexual assault, 20% had violent or abuse by spouse or partner, and 40% had other traumatic experiences growing up. Other statistics on the men's side of law enforcement: 17% had childhood trauma, 7% sexual abuse trauma, 12% physical abuse, 9.8% emotional psychological abuse, 12% military combat service, 22% natural disaster, 26% robbery and mugging, accidental disasters, 22%, and 19.5% of other traumatic experiences. For mental health professionals, 36% of women experienced childhood trauma, 19% child sexual abuse, 24% child physical abuse, 51% emotional psychological abuse, 7.6% adult sexual assault, 16% violence or abuse by spouse, 6% natural disaster, 8% accidental disasters, and 15% other traumatic events. And last but not least, the men for mental health professionals: 23% childhood trauma, 10% child sexual abuse, 18% child physical abuse, 39% emotional psychological abuse, 4% violent or abuse by spouse or partner, 14% military combat service, 3% natural disaster, 12% robbery or mugging, 19% accidental disasters, and 22% had other traumatic experiences. Now, those statistics from that article are not meant to scare anybody, but the reality is that those who work in mental health and those who work in law enforcement who are meant to serve and help others have their own personal traumas and histories, that they also need self-care and personal psychological abuse that they've gone through that they need to work through themselves, and it's important to recognize that. Adding on from that last side to mental health professionals and law enforcement professionals having history of abuse, it's important to recognize that in their workplace they're exposed to similar violences from when they were children and may bring up old traumas or even new traumas, such as law enforcement officers getting into a shooting experience or death by cop or such as that. I think the whole idea of this article, which broadly helps explain, is how self-care is crucial for people to be successful in mental health and law enforcement experience, so one is healthy, both mind, body, and spirit.